One study found that 86% of emergency room nurses meet criteria for compassion fatigue. 86%. This might explain why it's so unpleasant to be in the emergency room as a patient. Did you realize that caring for hurting and deeply needy people could have side effects on you as a carer? Human suffering and pain is not something that healthcare workers can avoid. We confront it, we embrace it, some of us, and we try to remove it. We try to heal it on a daily basis. This is what we do. This is our mission. But embracing all of this suffering and pain can take a toll on you emotionally, psychologically, and spiritually. And this can even result in what we have begun to refer to as a secondary trauma. In the 1960s, this term, compassion fatigue, began to be used popularly as a way to explain a phenomenon that was beginning to be observed in sectors of society where there was a lot of work done to protect and care for people who were in need. And in the 1990s, this was more formally introduced into the medical literature as a term describing a very distinct and set category of symptoms and signs. And over the years, it's been described more and more and studied further as an unfortunate side effect of working in the healthcare field. It's a term I particularly dislike, and perhaps am a bit disdainful about, and I'm sure others also dislike it because it actually sounds so trite for what it's actually describing. But compassion fatigue, it is, because that has stuck, and it's a core feature of what we think about when we talk about risks to healthcare workers from serving and from giving. It has its underpinnings in the idea that compassion is a core feature of healthcare. And that I agree with. Compassion formed the basis and the original religious foundations of early hospital care when monks set up areas for the sick within their monasteries. And compassion was what drove that, and specifically a particular kind of compassion that was observed in the life of Christ. Patients are actually pretty miffed with us when we don't produce this compassion that's supposed to be core to healthcare. How many times have you heard that? Somebody complaining about their trip to the emergency room where they were treated like a number and nurses were like, "Oh, you're in pain," and walked away. That sense of no compassion in the encounter, it's pretty offensive to us. It's because we have been trained to believe it should be present in healthcare. That's what healthcare is all about, isn't it? Here's some definitions of what is compassion fatigue. The emotional and physical distress caused by treating and helping patients that are deeply in need. This can desensitize healthcare professionals to others' needs, causing them to develop a lack of empathy for future patients. It's a form of traumatic stress. We now have begun to realize in studying it further that healthcare workers can display some of the same kind of symptoms and signs that people with PTSD display. And this is not because they themselves have had a trauma, but they've been encountering trauma and secondarily have picked up some of the same negative side effects of the trauma. This has been described in the literature with a huge range of prevalence, and it probably depends on what sector of healthcare or what intensity of healthcare you're talking about. But the range of this occurring in healthcare workers is anywhere from 18 to 86% of healthcare workers experience compassion fatigue during their career. And for some of them, it is a career-ending phenomenon. One study found that 86% of emergency room nurses meet criteria for compassion fatigue. 86%. This might explain why it's so unpleasant to be in the emergency room as a patient. Another study found that 25% of ambulance paramedics had severe ranges of post-traumatic syndrome. That's troubling. They're right on the front lines of some of the most horrific trauma. Makes sense. Another study found that 34% of hospice nurses met criteria for compassion fatigue. These are our nurses who are with us in the last moments of our lives, and they're struggling with compassion. Something is wrong. The features of compassion fatigue are described as lowered concentration, emotional numbness, feelings of helplessness, irritability, lack of self-satisfaction, withdrawal from people and relationships, physical aches and pains, exhaustion, anger, rage, reduced ability to feel empathy. And that to me is the part that hurts the most. So many of my fellow healthcare heroes, I know what drove you into this field was a deep and fulfilling sense of empathy toward people who are suffering. It's what you went into this field with and for. And to find yourself without it and unable to conjure it up, almost unable to get through your day, just patient to patient, irritable, frustrated, helpless, confused, lack of concentration, all of these things, that's a devastating place to find yourself. The higher the intensity of a healthcare area, the higher rates of compassion fatigue we see. So in certain areas where there's intense, emergent, life-threatening encounters all the time, like the emergency room, like the ICU, like trauma surgery, like sometimes obstetrics, the higher the rate of compassion fatigue that we see. And there have been some organizational features that have come up through the studies that are associated with a higher incidence of this. And they're ones that make sense to us. So having a culture of silence normalized within an institution where people don't talk about what just happened, where there's not debriefings, where colleagues don't share with each other, don't talk through the traumatic things. We just don't talk about it and move on to the next thing. We have a lot of work to do. Just tough it up. That's not helpful. Places where there are long staff hours, no joke. Places where there are short staffing, which I have yet to find a place I've worked in that does not struggle with short staffing. Workplace incivility, where individuals tolerate rudeness and don't demonstrate kindness in their interactions with each other. Where there's feelings of being invalidated or dismissed by managers. Where the volume of patient interaction is high. So you become desensitized to their acute needs just because there's so many in such rapid sequence, you can't even keep up. Emergency room is the perfect example of this. And these are all institutionalized around us, not helping us. There was an emergency room doctor in my recent past that was a perfect example of this whole constellation of signs and symptoms. We had, just been through COVID, and the stress and the strain and the trauma on emergency room physicians and nurses during the COVID pandemic was astronomical. It's a wonder that any of them have stayed in medicine. We've lost a lot of them. And this particular physician had just gradually through the pandemic and afterwards just developed such what we would call a chip on his shoulder. He just was so irritable. He was combative. He was verbally aggressive. We all dreaded hearing his voice on the phone calling from the emergency room, because he was so aggressive. He would interrupt everything you had to say. It felt like his only goal was to get patients out of his emergency room. And maybe he hadn't even actually seen the patient. He was calling you as a consultant to admit the patient. And you're starting to ask him questions. And he's just, oh, it was like, everything was so combative, and it was so uncomfortable, and it was so miserable. He was miserable. And it struck me at one point, this poor man has lost the thing that sent him into medicine. He's lost his compassion. He's lost his hope. And that physician actually eventually left his job, and he left medicine. And I see that as a huge loss. The loss of a physician after anywhere from 12 to 20 years of training, all that we invest into this individual and what they can bring is gone because of this secondary trauma, this inability to rise above it, and the lack of compassion. It's not just a problem of experienced healthcare workers. So you would think if that were the case, it's just over time, this wears on you, and facing all this need and trauma results in this. But studies have shown that young physicians and nurses are just as vulnerable to this as the more experienced. It's not just time exposure that's causing this. And certainly the consequences to healthcare is that as we're feeling this, we start to try to develop strategies to avoid this uncomfortable phenomenon of symptoms. We don't want to be in this kind of misery and pain, and we avoid interactions with others. We start depersonalizing patients because we just don't want to experience their trauma. We just don't have anything left to give, and there's breakdown of therapeutic relationship because empathy is not present. Empathy is absolutely critical to a patient trusting you. Healthcare professionals, I'm so excited to be able to connect with you on issues regarding spiritual needs in healthcare. We want to partner together to see some of the ruined places of healthcare culture restored by hope. Follow us at restorehealthcareproject.org and like and subscribe to our YouTube channel and social media. And without trust, there's not a therapeutic relationship. So this is breaking down in our healthcare system as the rates of compassion fatigue increase. We're also seeing high rates of job changing. We see people trying to fix this by switching the unit that they work on or the facility that they work in, or trying a different subspecialty. They're trying to find a way to make this go away. And the results on our healthcare system are significant too, because every time somebody moves, we have to train a new person. We have staff turnover, and now we have to find new nurses, and we have to do the whole orientation and training all over again. And the burden that puts on a system that's already short-staffed and under-resourced is tremendous. This is not a small and insignificant thing that's happening. And then let's not even mention those individuals who are experiencing this, that perhaps that doesn't fix how they feel. Then they might change their career. Then they might have mental health crisis. And we see increased rates of loss of employment. We see increased rates of substance abuse. And we see increased rates of suicide among healthcare workers, especially in the high-intensity subspecialties. Various approaches have been theorized and suggested to try to mitigate and prevent compassion fatigue. And quite frankly, these studies, when you review them, there's limited success. It's a lot of theoreticals. We're told that we should increase our mindfulness and meditation skills. We're taught that about recognizing signs and symptoms of compassion fatigue. Well, that's great, so we can diagnose it. But then, how did that help prevent it? How did that help treat it? We have teaching programs about positive coping strategies for stress. And some of these are things like you should take breaks when you work. You should go to the bathroom when you work. You should eat at some point during your shift. These are the coping strategies we're being taught. That is a very sad state of affairs. You should take time off. Time off is good for reducing compassion fatigue. Yeah, we have to teach this. This is not a good state of affairs. By far the most effective in some of these studies is peer support programs. And I think that's particularly interesting because we know what happens in peer support is comfort. And I think that's a real key to breaking out of this terrible cycle of compassion fatigue. Unfortunately, even with all these efforts, all these studies, these training programs, hospitals are trying to institute provider and clinician well-being programs, trying to get you to go to yoga, trying to get you to go to eat. Yeah, all these things. We're still not seeing rates of compassion fatigue decreasing. They're just increasing. I want to disrupt the narrative a little bit about this because it's not that I don't think it's a real problem or a real thing. I do. I'm trying to tell you I think this is a real problem. But I think that I'm concerned that nobody is talking about solutions that are effective. And I think in particular, nobody's talking about spiritual solutions that are available. I think it's a travesty because probably spiritual solutions are the most effective treatment for this problem. Let me tell you why. Compassion is the specific purview of spirituality. It's not a psychological phenomenon. It comes from a person's spiritual connection and meaning. And it is one of the core attributes that the Bible discusses that God has. He is the definition of compassion. This is the template from which we understand compassion. And the Christian worldview about compassion is what originally drove the formation of hospitals, formal healthcare systems. Trying to solve the crisis with compassion fatigue without God is absolute insanity. If God is a source of compassion, why are we not talking about what God has for us in this moment? Lamentations 3:19-26. The writer of Lamentations was Jeremiah, an ancient prophet who understood suffering, and he wrote about it in this way. I remember my affliction and my wandering, the bitterness and the gall. That sounds like the emergency department. Yeah. I well remember them, and my soul is downcast within me. Yet this I call to mind, and therefore I have hope. Because of the Lord's great love, we are not consumed. For his compassions never fail. They are new every morning. Great is your faithfulness. I say to myself, the Lord is my portion. Therefore I will wait for him. The Lord is good to those whose hope is in him, to the one who seeks him. It is good to wait quietly for the salvation of the Lord. Because of the Lord's great love, we are not consumed. The trauma that we encounter, the pain that we experience and we interface with, it doesn't eat us up. Because of the Lord's great love. Why? Because his compassions do not fail. Jeremiah seems to understand something about compassion fatigue and burnout. He can describe it perfectly, what it feels like. And his solution is one that's not being discussed in our healthcare forums right now. He made the claim that it's actually the love of God that made the difference. The compassion of God does not fail. It doesn't run out. This is what we have come to know about God. Ours does. It just does. It is the natural history that compassion fatigue, when taxed and drained, it will happen. And the solution to it is a spiritual one. It turns out that it's only Jesus who was able to carry all of the suffering of the world. We are not able to do that. We were not designed with the capacity for that, but we were designed for the capacity to have a relationship with one who can. And that is the solution that I would propose to our healthcare sphere. Isaiah 40 says, he gives strength to the weary. He increases the power of the weak. Even youths grow tired and weary. and young men stumble and fall, but those who hope in the Lord, those who wait on the Lord, they will renew their strength. They will soar on wings like eagles. They will run and not grow weary. They will walk and not faint. There is this incredibly mysterious way that relationship with God, with Jesus, gives us access to this renewable source of compassion in Jesus. This waiting on the Lord. This is why we need time off. We actually need time off to nurture a relationship with the one who can fill us up again. We need time and space to refill. And I would venture to say the more intensely you encounter trauma, the more frequently you encounter it, the more frequently you need time off. And we need to make it okay for that to happen. I have, over the years, kind of figured out what that sweet spot is for me. And it really depends on a lot of factors. But if I am taking a lot of call and I am encountering a lot of trauma, I need time off at least every 6 weeks. And that might be different in a different specialty. You may need a 3-day weekend to recharge every month if you are in trauma surgery. And we don't have a culture built around giving each other that kind of space. And I'm not talking about just the kind of time off where you go and do many things and you get things done. You need time to wait on the Lord. That's where we get recharged. You need to have time to nurture your relationship with Jesus, because it's not in spiritual practices that you're going to find this refilling. It's in spiritual relationship with a person who is the renewable source of compassion. Yes, meditation is good. Yes, relaxation and breath work is good. It's good for your body. Funny how that's present in prayer. So we don't need to recreate something without God. God is the center of what we need. And God will give us meaning to this suffering that we're encountering. God is great about that. He says, "Come to me, all you who are weary and heavy laden, and I will give you rest." I will actually allow your brain to rest. I will help you to assign meaning to the suffering and purpose. I will transform it. It's natural to weaken and stumble on, trip on the secondary trauma of what we encounter. And we should be humble about it. We are going to struggle with that. This is intense. But we do know one whose compassion does not fail. I know some people would say, but Dr. Kang, are you really saying that Jesus is the answer to compassion fatigue? Like, that is not culturally sensitive, probably not culturally appropriate, and it's like borderline offensive. And I would say to you, you know what I think is offensive? I think me withholding my treatment recommendations for what I know is the most effective treatment, that's offensive. If we don't speak up and begin to say, hey guys, you're missing something. There is a spiritual solution for this, and it's not hard. It's not complicated. Well, Dr. Kang, lots of people don't have a spiritual practice of Christianity. This isn't going to have any application to them. Like, they have other spiritual mentors or traditions, and you need to be sensitive to that. Sure. But show me somebody a spiritual mentor, a spiritual tradition, what you name it, that is as good as Jesus. I'll consider it. Show me someone who can actually transform trauma and turn it into your triumph. Do you know someone like that? Is your mentor like that? My Jesus is like that. And he is an unending source of compassion, unending. I can always find it. I can always fill it up again. I've got enough every time I go to him. He gives generously without finding fault. This is the promise. The answer to compassion fatigue has a spiritual solution, and his name is Jesus. I'm Dr. Jennifer Kang, and this is the Restore Healthcare Project. Hey, Healthcare Tribe, I hope that you've been impacted by what I've been able to bring through this podcast. I also want you to know about some opportunities to give back through my nonprofit, Selah Health International. We work to support projects for women and children of vulnerable populations around the world. You can learn more and donate on our website, selahhealthinternational.org.